huge challenge to get vaccines to everyone, from the biggest cities to the countryside. Madeline O'Neill explored the unique logistical challenges in both urban and rural settings and what obstacles everyone is working to overcome to make sure you get your shot, no matter where you live.
The pandemic has a way of making things feel far away. Our loved ones, neighbors, and a return to normalcy.
We want to get out there and we want to vaccinate people. I mean, this is what we've been working on since March.
The rural parts of our state may seem especially out of reach.
I think the biggest thing for us is resources. You know, we do not have the amount of resources that a bigger urban population would have. But what the great thing is we do have a lot of great partners.
The Sauk County Health Department is keeping close ties with hospitals, including SSM St. Clair Hospital in Baraboo.
We are really striving to make sure that we deliver this vaccine as equitably as possible.
Going the distance to overcome any hurdles they may face.
There is a large rural population, and some of them have to travel great distances to get to their local healthcare providers to receive the vaccine.
But other than that, the SSM Health Network, which has more than a dozen vaccination sites across Wisconsin, says the vaccination process isn't miles apart.
The process is different for us, but in the eyes of a person coming in for the vaccine, it looks the same.
Dane County has more people and more healthcare workers, but that's balanced by more vaccinators.
So everyone's doing their best to make sure that we're getting vaccine out as fast as possible. For us, that means, scaling up at Alliant Energy Center to make sure that we're able to get big fast.
For others, it can mean vaccination clinics. Upland Hills Health in Dodgeville had its first for Phase 1B patients Saturday.
It was very joyous. I have to say, it was one of the highlights, I would say, of my career.
They use the Moderna vaccine, which doesn't require as cold of storage as the Pfizer vaccine, preferable for rural areas.
We are not seeing any specific challenges being in the rural setting. We have been receiving our vaccine in a timely manner.
Rather, Ancillary Services Vice President Chris Ann Carl says the barrier is one all health officials share.
We haven't been getting enough Pfizer and Moderna vaccines as a state.
There's no line in the sand or snow here in Wisconsin when it comes to lack of supply. Last week, SSM Health got a third of what they requested, and the Sauk County Health Department received a quarter. Upland Hills usually gets anywhere from 25 to 40% of its request.
We have a terribly difficult situation with nearly 300,000 doses requested and only 27% that we could provide.
So we're all in the same boat on this.
All in the same boat in another way, too.
So we're all collaborating together to make sure we can get the vaccine out as quickly as we can.
That collaboration bringing us closer to our loved ones, neighbors, and a return to normalcy.
I think the biggest thing would be patience.
In Madison, Madeline O'Neill, News 3 Now.
One obstacle to getting a vaccine can be internet. Both SSM Health and Upland Hills Health have set up a phone line for those with spotty access to sign up. The